The beach at Port Dover is a wonderful place to meet people, and that's probably the first time I met her. I remember her eyes, because they were probably the prettiest eyes I'd ever seen, and still are. They still twinkle. In September 2005, she was diagnosed with breast cancer.
2 years ago, it was diagnosed that it had spread to her bones. Getting the news that it had spread was completely overwhelming, and to be honest, I felt somewhat overwhelmed ever since. You don't know what each day or each hour is going to bring.
We were originally living in Port Dover. That's where we first started to get the CCAC, and they provided nursing care and some help in the house.
Almost a year ago, my parents moved here to Waterloo to be closer to my family and also the cancer clinic and the hospital. And at that time, the care was transferred here amazingly smoothly. I was sure we would miss at least a week of care, but they didn't miss a beat. She became very ill with an infection, and she was hospitalized for a week, then moved to a palliative care wing of another hospital facility in the city. And while the care was exactly what we needed and very, very good, we felt we would try as a family to see if we could bring her home.
She responded to it so well that we've continued to stay here.
She's at home and comfortable, and her anxiety is greatly reduced. We're not just caring for my mother, it's my father that we're also equally concerned about. He's certainly much more comfortable in his own home and more comfortable that what's going on with Mom's care.
If she calls me, I'm there, and that really is important. The thing that I'm extremely impressed with is the coordination among all the health services here.
If you are dealing with one arm of the operation and they think you might benefit from another that you would have no other way of knowing about, they will take the time to ask you, did you know this might be available?
They talk to each other. There seems to be that communication.
We have no control over the disease. We have no control over what's happening to my mother and the impact it's having on all of us. To at least have some choice and control over her care and how the last months of her life unfold is pretty important.